Clinical case vignette. Nerve injury following mastectomy. A 52-year-old woman presents to the neurology clinic complaining of weakness in her lower limbs and pain in her right foot. She underwent a right mastectomy with axillary lymph node dissection 6 months ago for breast cancer. After the surgery, she noticed that her right shoulder blade protrudes when pushing against a wall. More recently, she developed difficulty walking, weakness in both legs, and burning pain in her right foot. On physical examination, right scapular winging when pushing against resistance, weakness in shoulder abduction beyond 90 degrees, decreased strength in both lower limbs, proximal and distal, diminished Achilles reflex bilaterally, burning pain in the lateral aspect of the right foot. Electromyography, EMG, confirms long thoracic nerve injury affecting the serratus anterior muscle and lumbar plexus involvement. Question 1. Which nerve was most likely injured during this patient's mastectomy? A. Spinal accessory nerve. B. Thoracodorsal nerve. C. Long thoracic nerve. D. Axillary nerve. Answer C. Rationale. The long thoracic nerve, C5-C7, innervates the serratus anterior muscle. Injury to this nerve results in scapular winging and difficulty abducting the arm above 90 degrees. This can occur during mastectomy with axillary lymph node dissection due to the nerve's close proximity to the chest wall. Question 2. What is the most likely cause of this patient's new-onset lower limb weakness and foot pain? A. Paraneoplastic syndrome. B. Chemotherapy-induced neuropathy. C. Lumbar plexopathy due to metastasis. D. Guillain-Barré syndrome. Rationale: breast cancer can metastasize to the spine and pelvis, leading to lumbar plexopathy, which causes proximal lower limb weakness and pain in the foot, often affecting the L5-S1 nerve roots. Chemotherapy-induced neuropathy, B, is usually distal and symmetric, while Guillain-Barré, D, presents with ascending paralysis and arflexia.
Question 3.
Which nerve root is responsible for the burning pain in the lateral aspect of the right foot? A. L3, B. L4, C. L5, D. S1. Answer. Rationale: the S1 nerve root provides sensory innervation to the posterior leg and lateral foot. Compression or invasion of the lumbar plexus or sacral nerve roots by metastases could explain this patient's symptoms. Which of the following additional findings would suggest lumbar plexopathy due to metastasis rather than a neuropathy from chemotherapy? A. Hyperreflexia in the Achilles tendon. B. Bladder or bowel dysfunction. C. Symmetric sensory loss in the feet. D. Pain that improves with rest. Rationale: bladder or bowel dysfunction suggests nerve root or spinal cord compression, which is concerning for metastatic disease affecting the lumbar plexus. Symmetric sensory loss, C, is more characteristic of chemotherapy-induced neuropathy, and rest, D, would not typically relieve metastatic pain. Summary: this patient has a long thoracic nerve injury, scapular wing from mastectomy, and possible lumbar plexopathy due to breast cancer metastasis. Her symptoms suggest S1 nerve root involvement, explaining her right foot pain. Would you like a different